Hi, good evening to Dr. Chris. I am from Group 2. We are from Gen Y Group. For this assignment, we decided to choose Jacob disease, which is a genetic disorder disease. So, what is Jacob disease? Jacob disease is rare disease and also it is a fatal brain disorder disease. This disease involves the brain degeneration of the patient from one time to time. So there are few symptoms. The early symptom of this disease is when the patient have failing memory and they also have behavioral changes. Other than that, they also lack of the coordination. And as the disease proceeds, the patient might experience blindness, and even the worst case is they might experience a coma. So there are three types of Jacob disease. First is sporadic. So sporadic is when the patient do not have any risk factor that cause this disease. And second type is hereditary. Hereditary is when they have family history. One of their family members have this disease. And third is acquired. Acquired when the patient are exposed to the medical procedure which expose their mental and nervous tissue system. These diseases are non-contagious. There are no evidence that shows that these diseases are contagious. So we are going to continue with rate of occurrence of Jacob disease.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Adina binti Ahmad Nazri and my metric number is 198536. So I will continue with the rate occurrence of Jacob syndrome. So basically, Jacob syndrome is a rare chromosomal disorder which only attacks male. So based on our knowledge, we know that the difference between the male and female is our chromosome, which female usually have double X chromosome and male has XY chromosome. So why Jacob syndrome attack male is because Jacob syndrome is related to the extra number of Y chromosome. So people who has Jacob syndrome has XYY chromosome. So the rate occurrence for this syndrome is 1 per 1,000 births, which make them very hard to found in the community.
My name is Nuridatul Shamira binti Baharom, with metric number of 197435, and today I would like to present about the causes of Jacob syndrome. So, Jacob syndrome is a rare disorder that happens throughout the world. So this syndrome, this rare disorder is not directly caused by what the parent do or what the parent do not do to their fetus. There are two causes of Jacob syndrome, which it can happen before the formation of the reproductive cell of the parent. So this is which are the egg and the sperms. And the second cause of Jacob syndrome is from early in the embryo development. So in most cases of Jacob syndrome, it is caused by the random mix-up or the mutation during the formation of male genetic code, which are the formation of the sperm cell. So the exact cause of the mutation or the cell division error in the formation of sperm cell is not well understood yet. So how this occur is that how Jacob syndrome occur in the sperm development is that it's caused by the incident in chromosome separation during anaphase 2, which is in meiosis, called the non-distension, which can result in the sperm with extra copy of Y chromosome. So when we produce the extra sperm with extra copy of Y chromosome, by incident when the sperm cell fertilize the egg cell, so this will contribute to the child with extra copy of Y chromosome. So the child will have severe symptoms of the Jacob syndrome. For the rare cases, it is caused in the early in the embryo development. So this occur due to the extra chromosome result in the incorrect cell division in early embryo development. So the boy that will be formed will have the mosaic form of XYY syndrome. This mosaic form means that only some of the boy cells have extra copy of Y chromosome, while some of the cells do not have extra copy of Y chromosome. So the boy that will be formed will have fewer symptoms of Jacob syndrome. So that's all from my part. Thank you.
So today I will explain to you guys about the inheritance pattern that occur in Creutzfeldt-jacob disease or Jacob syndrome. So in most cases of Jacob syndrome or 47XYY syndrome, it is not inherited from the parents. The chromosomal change usually occurs as a random event during the formation of sperm cells. When an error occurs in cell division, that known as the non-disjunction, the results from this error will cause the sperm cells has an extra copy of Y chromosome. So if one of the these reproductive cells contribute to the genetic makeup of a child, the child will resulting having an extra copy of Y chromosome. So when the child has extra copy of Y chromosome, of course she or he will result having Jacob syndrome or Creutzfeldt-jacob disease. And also this 47XYY mosaicism is not inherited. It occurs in a random event during cell division in early embryonic development. So the person having this syndrome is not caused by their parents. Basically, it occurs when there is a error occur in the cell division that known as the non-disjunction. So Jacob syndrome is not inherited.
So my name is Muhammad Hafizi, and I'm going to present about Jacob syndrome, the gene related to Jacob syndrome. So Jacob syndrome happen only in males. So the karyotype consists of 22 pair of chromosome, which is we have autosome and sex chromosome. So we have one pair of sex chromosome, and it has a combination of XYY chromosome. So the double Y of the chromosome occur because mutation happens. So that is the gene related to the Jacob syndrome.
Nazir, I will tell you guys about the diagnosis of Jacob syndrome. In fact, 88% of persons that have Jacob syndrome is not diagnosed earlier because they do not show the symptom of Jacob syndrome. The symptom is like larger head dimension, behavior and emotional difficulties, and learning disabilities. So the Jacob syndrome mostly are diagnosed earlier when the prenatal karyotyping is be done for the detection. The detection is through two ways, which are amniocentesis and chorionic villus sampling, or we call it as CVS. Amniocentesis is involved gathering of sample fluid of the fetus, meanwhile the CVS is remove of the tissue sample from the placenta. Next, after that, chromosomal studies performed to the fluid and the tissue sample to present the extra of the Y chromosome. If the prenatal diagnosis is not be done, the person who have the Jacob syndrome can do diagnosed by blood test to present the Y chromosome extra at their body. So next, I will explain about treatment of Jacob syndrome. Actually, there is no treatment for Jacob syndrome. It is because we cannot crack our sex chromosome in our bodies. So the person that have Jacob syndrome can get help with any learning or developmental delays through speech therapy, occupational therapy and other assistance. So the first treatment that can be done by the person is by regular doctor visit. By the visit, doctor can monitor the boy's development for delays, social and language disabilities. If there is any other health problem, the doctor will detect and explain how to overcome it. Next, educational support service to teach the boys to keep pace in school, and speech therapy and physical therapy can improve speaking, reading, writing and help increase in strength of coordination. Occupational therapy include help in develop more confidence and interact better with other people. So that's all for me. Thank you.
So, in conclusion, these diseases are caused by the genetic disorder which they have extra Y chromosome. They might have XYY or also triple Y. So this disease cannot be cured, but the patient can undergo a few therapies such as to improve their speech and also to improve their coordination skills. And the rate of percentage that this disease might happen is very low. There are articles state that this disease might only happen 1/1000 of childbirth. So the rate of occurrence of Jacob disease is very, very low. That's all from us. Thank you.